Hello, my name is Bertha, and this is my week 7 MRI presentation. I'm going to talk about how to do a liver abdomen um, routine exam as well as a pelvis exam. And the first thing I'm going to do before I start any exam, I'm going to demagnetize, make sure I have all ferrous items off my clothing and also off me, such as necklaces, watch, cell phone keys, things like that. And then I'm going to walk into the Zone 4 MRI scanning room, and I'm going to put gloves on, grab some sanitizing wipes. I'm going to wipe down the coils, the headphones, the emergency squeeze ball, the scanning table, put fresh clean linen. I'm going to lower the scanning table for the patients so they can easily climb on the scanning bed. And then I'm going to go ahead and walk out, shut the door behind me. I'm going to also check for, look at my inquisition, check the exam order, make sure I have the patient's information, the type of exam I'm going to be doing, and the doctor's signature. Once I have done that, then I go ahead and grab my patient. I'm going to grab my patient from the lobby. I'm going to call them by their first and last name. And then I'm going to go ahead and greet them, and then go over their reasons for their visit and go over their screening and make sure that they don't have any implants or electronic devices in them. Once I cover all those things, I'm going to go ahead and take them over to Zone 2 and have them change out of their street clothes. After I have demagnetized again, I'm going to take the patient with me into Zone 4, and then I'm going to have them lie down for this particular exam, which is the liver abdomen. I'm going to have them lie down supine feet first, preferably supine head first for the exam. And then I'm going to go ahead and grab the coil, which is the phase array or torso coil. So I'm going to place the coil right underneath their armpits, and I'm going to have them raise their hands over their head. And then I'm going to go ahead and put their earphones on and give them the emergency squeeze ball. I'm going to go ahead and place the laser landmark on their on the xiphoid process, which will be like about right here. I'm going to then check with the patient to see that they're ready to start the exam. And I'm going to also let them know that there's going to be some breathing instructions. And then I'm going to walk outside the scan room, shut the door behind me, and go to the control room, and I'm going to set up my scouts. So I'm going to make sure all my 3 planes are set up, which is the coronal, axial, and sagittal. For the axial planning, I'm going to cover from the dome of the liver through the inferior liver or kidneys. And then the field of view should include the entire abdomen, soft tissues. For the coronal breathe hold sequence planning, I'm basically gonna have the field of view, including the dome of the liver and the kidneys. And the slice coverage should include all of the soft tissues of the abdomen. So running a coronal breathe hold will allow me to know where the liver and the abdomen organs are during inspiration. For the axial breathe hold sequence planning, again, the slice coverage should include the dome of the liver and the kidneys. And then the field of view should include all the soft tissues of the abdomen. So when all pre-contrast sequence are done, you inform the patient that they will be receiving the contrast on the next scan, and then you'll notify them if they have any trouble to inform you, or like squeeze the emergency squeeze ball. So some scanners use real-time tracking techniques called fluoro triggering to watch the contrast start to enhance. And then as soon as you see contrast enter the pulmonary arteries and or the in the aorta, you can begin the multi-phase axial sequence. It's good practice to assess the patient after they've been given the contrast to see how they're doing. And so overall the power injection works by delivering contrast at a certain rate. Um, since we need precise timing for imaging the abdomen, the abdomen. Um, for a general routine pelvis exam, I'm gonna have the patient lie down, supine, and feet first, and then I'm gonna have their arms relaxed to their side, and I'm going to place their headphones on, give them the emergency squeeze ball, and the landmark for this exam would be the mid pelvis. The coil for this particular exam is going to be the face array abdomen pelvis torso coil. So once the patient has been positioned comfortably, I am going to go ahead and run my scouts. My scouts are going to be the coronal, axial, and sagittal. And for my axial sequence planning, I'm going to cover from the iliac crest through the iliac from iliac crest to the iliac crest to the pelvis to get the full anatomy. For the coronal sequence planning, I'm gonna angle between the hip joints to create a true coronal. For sagittal sequence, I'm gonna angle between the hip joints to create a true sagittal. Once I'm done running my sequences, I am going to go ahead and assist the patient off the scanning bed and tell them that they did a great job and holding still. And I'm going to also thank them for allowing me to care for them and just wish them a great rest of their day. And that's about it.